Hello, my name's Adrian Richards. I'm a consultant plastic and cosmetic surgeon, and today I'm going to be talking a little bit about what you can expect from an inverted nipple correction. So you'll have met me or met one of the other surgeons, and we'll have gone through the procedure, about what's involved and the likely outcome. We generally perform inverted nipple correction as a local anaesthetic procedure, which takes approximately 30 minutes to do. So that's 15 minutes per nipple. So what we'll do before the operation, you'll have booked your date in the clinic, and then approximately a week before the clinic we'll phone you up and tell you what time to come in, so that you don't have too long a wait. Before the operation, it's important to avoid any non-steroidal anti-inflammatory drugs like Nurofen, aspirin and Voltarol, as they can cause thinning of the blood and increase the risk of bruising. Okay, there's other tablets with medications we don't like you to take, and often these are homeopathic, so it might be ginkgo, St John's wort and vitamin E. Don't take those before the operation because again they can increase your risk of bruising. So come in on the day. We like you to sort of take it a bit easy over the previous few days following the operation, before the operation, to make sure you've had enough sleep, haven't been out too much. Come in, get someone to drive you. It's important. You shouldn't drive home yourself after this operation because you've had an anaesthetic, albeit a local anaesthetic, and often if you did have a problem insurance-wise, your claim wouldn't be valid if you've just had an operation. So get someone to bring you in and take you home. Okay, so you'll be taken into the operating theatre where you see me. If you haven't had photographs taken of the nipples, I'll take photographs and explain the procedure to you. Then I'll put some local anaesthetic in under the nipple. Now this is the uncomfortable bit. It's uncomfortable for about a minute per side, and after that you shouldn't feel any pain. You might just feel some movement, but you shouldn't feel any pain after that. But there is some pain initially as the anaesthetic goes in. Then I'll correct the nipples. That's done very, very small incision on the outside of the nipple, as I've discussed in other videos. The ducts are divided, and the nipple is held in an everted position by internal stitches, and then the dressing's put on. The dressing is approximately that thick and can be placed under a bra, and is basically a foam dressing which it surrounds the nipple, and then brown tape, micropore tape, which is flesh coloured, on the skin. So we like that to stay on until we see you again for follow-up, and then you can put your bra over the top. So following the operation, you need to be driven home. You need to keep mobile, but refrain from any sort of activities which can cause more swelling, more bleeding. So housework is out. Anything that involves stooping is out. But we do like you to sort of take it nice and easy. You keep the dressing intact. Don't get it wet. So if you're going to shower around it, or just strip wash during that time. Then we'd normally see you at your convenience 3 to 4 days following the operation. So if the operation was on a Monday, we might change the dressings on a Friday. If the operation was on a Thursday, we might change the dressings on a Monday or a Tuesday. Change the dressings. We'll give you that point before you leave, and make sure everything's okay. Sometimes there's a tiny little stitch to remove, but it is absorbable. In most instances, we will leave it just fall out on its own, and the internal stitches you shouldn't see. So at that stage, 4 days later, we may reapply a very light dressing, but we won't apply a bulky dressing at that stage. The nipples will stay quite reasonably swollen during that stage and slightly more prominent, and then in the weeks following surgery, the swelling goes down and the inversion, they get slightly less prominent, and they could be slightly bruised at the early appointment, and this will slowly decrease. We often give you either arnica gel or a gel which we found very useful, vitamin K gel called Aurora to reduce the bruising. The sensation in the nipple should be normal after the operation, so you shouldn't have any differences with that in most cases, and normally we find that the nipples have really returned to pretty much normal, their finished appearance by about 2 months. So I hope that's been helpful in explaining the process and what you can expect from an inverted inverted nipple correction. If you have any queries about the treatment or would like to speak to someone who's had the operation, please contact us either via email at aurora-clinics.co.uk or phone us on 01844 214 362. Thank you very much. We look forward to seeing you soon.